Today I'm going to be talking about dental implants. There are various types of scenarios in which dental implants can be used to rehabilitate a patient's dentition.
Yeah. I know some of these words.
Dentition is the teeth that we have in our upper and lower jaws, and it's just a clinical way of saying teeth. A dental implant is a screw that is manufactured from titanium.
Custom made. Titanium alloy.
And this screw goes inside your bone and heals underneath your gum tissue, and then there is a prosthesis, which is either a crown or a bridge or whatever your treatment plan is. That dental prosthesis, which is a fixed appliance, is fixated on top of that screw. The second type of situation in which implants can be used to rehabilitate a patient's dentition is when you have multiple missing teeth, but the remaining teeth that are in the mouth are in healthy condition periodontally, and they don't need much restorative work. In those situations, we can place 2 or 3 implants and make implant bridges to replace those missing spaces. The third scenario in which dental implants can be used to rehabilitate a patient's smile or dentition is to place implants in an all-on-4 fashion, where implants are placed, either 4 to 6 implants depending on how much bone you have, and then those implants serve as an anchor point on which the final prosthesis is fixed. An all-on-4 procedure is done in a scenario when there are multiple missing teeth, or the remaining teeth are in such a poor state in terms of the amount of bone loss they've had or the amount of decay they've had, that we are not able to restore them aesthetically and functionally. In those cases, an all-on-4 procedure is the best treatment option. Majority of the practices that place dental implants in this all-on-4 fashion use a temporary denture and then convert that denture the same day into a fixed prosthesis. Some of the cons that are associated with those temporaries are the fracture of the temporaries, and then you are on a very soft or liquid diet for the next 4 to 6 months.
I think that's the worst thing I've ever heard.
And that's when you get a final prosthesis, which is your permanent prosthesis. Whereas here at Nuvia, you will be getting your final prosthesis in the next 24 hours, which is both functional, it's aesthetic, and you'll be able to enjoy all the foods that you like to enjoy.
That's what I'm talking about!
Zygomatic implants is another option to replace missing teeth in patients who don't have enough bone in their jaws. So in this case, we obtain support from the zygomatic bone, which is your cheekbone, in other words. These implants are significantly longer than traditional dental implants because they obtain support from the zygomatic bone, which is your cheekbones. However, they provide the same aesthetic and functional results. It was fun talking about dental implants and talking about all the pros and cons associated with the different scenarios in which you can use dental implants. I truly enjoy what I do, and I'm passionate about what you do. If you also enjoyed this video, please click on the link above and watch another video.
You guys, I'm like really smart now. You don't even know.